Eczema is really interesting because it's not one thing. There probably are multiple subtypes of this disease, some of which may even have different etiologies. There might be a reason underlying that is different from one patient to the next. At this point, we don't really fully understand all those nuances, so we kind of clump them together, and by and large, we can figure out what it is, at least the correct family, and we can usually get things better for most people. There are 5 different pathogenic parts of this disease, or what I call the therapeutic pillars that we think about treating. The first one is the skin barrier. We know that by definition, the skin barrier is damaged or impaired in patients with atopic dermatitis or eczema. What I tell my patients is that it's kind of like leaky skin. Water can get out very easily, but more importantly, allergens, irritants, pathogens, bacteria, other things can get in an abnormal way. So that's part 1. Part 2 is the inflammation. There is a crazy immune response that's activated in this disease, and part of what it does, of course, is cause that sensation of swelling and redness. It also drives itch, but it also furthers the skin barrier damage. It releases factors that damage the skin barrier even more. The third part is the microbiome, and we're learning a lot more about this. I mean, honestly, this entered the chat about 5 or 10 years ago. Before that, there was almost no discussion of it. It turns out that the microbiome is playing a role in keeping everything balanced. It also helps protect us. It's part of us as a superorganism. And we know in atopic dermatitis, the microbiome starts to fall apart. This term is dysbiosis. And I would say that it's a very, very good indicator of disease severity and activity. There's a behavioral piece to this condition as well. There's a mind-body aspect of atopic dermatitis, and we find that, of course, being itchy, uncomfortable, and not sleeping well, which a lot of our patients report, has a direct effect on your mind. But the state of your mind has a direct effect on your skin. So again, we have this vicious cycle where it can actually spiral out and out and out, and people can really be in a dark spot. And then the final piece of the puzzle is more of the nerve endings in the skin, the itch sensation. And when people feel itchy, of course, they want to scratch. When they scratch, they can physically damage that skin barrier and also change those nerve endings even more. Again, cycles within cycles. So I often think about this as a disease of vicious cycles, and to break it, sometimes you actually have to treat multiple aspects at once. Otherwise, even if you're fixing one thing, you're maybe trying to push back against the inflammation, all those other pathogenic factors are pushing forward and you can't seem to escape the vortex.